Unmute yourself before you start your presentation, I guess. Thanks, Jocelyn, and good morning, everyone. So we are here today for our PDA 2020 Measures and Methods Session 3. And we're going to talk about data visualization and communication today. So welcome. We're happy that you're here. We're excited to share this information with you. And before we dive in, let me share with you who's going to be sharing some information with you today. Of course, I am Lynette Thielen. I'm a senior consultant at CCSI, and my background is in quality improvement and developing processes and workflows, and improving those. And my co-presenter today is a familiar face if you are participating in our other PDA session. So I will let David take a moment to introduce himself.
Sure. Good morning, everybody, and welcome. So as said, my name is David Warsnick. I'm the Senior Director for Fiscal Performance Improvement with CCSI. A little bit about my background. I've been in the public behavioral health industry for a little over 42 years now. Started as a substance use counselor, mental health counselor. I was a program manager. While I was doing my clinical work, I got my MBA, and for 32 years was the Chief Financial Officer for Spectrum Health and Human Services in Western New York. And the last 10 years or so, I've been focusing pretty exclusively on data analysis, data visualization, integrating financial modeling data with clinical outcome data, and I am thrilled to be with you this morning. So thank you, Lynette.
Yep, thanks, David. Okay, so just a little bit about what we're going to be covering today. We're going to just take a moment to review, the review from session 2, so session 1 on the little road sign, but we're going to talk a little bit about just reminders of what we covered in session 2. And we're going to, as I mentioned before, spend our day today talking about visualizing the data and communicating that data. So let's actually dive in from there. So session 2 highlights. We covered really a lot of our session 2 was about defining the measure. So we talked a lot about how defining and that leads to ensuring that you have a common understanding of your metric across your organization. It makes sure that your metrics are standardized and that you're able to replicate the measure, and that every time you're pulling data that you know that you're doing it the same each time. We talked a lot also about making sure that your measures are SMART measures. So SMART stands for they're specific. You outline the who, what, where, when, how. You're measuring items that are measurable. You're creating measures that are achievable, relevant, and time limited. So that SMART acronym is really a nice way to do a little check-in on your measures to make sure that you've kind of got all the characteristics that you need. Where to start? That was another thing we covered in our last session. And we know that there's a lot of different things that you can measure within your organizations. And we're using access and engagement as kind of our focus in these discussions so that we have a measure to be talking about. And it's really a critical measure at this time, especially given that we've seen changes in our access and engagement measures with the pandemic and with the change in how people are engaging with our organization, engaging in their care. But those aren't the only ones, but we use them a lot as our examples. A big focus of our session 2 was the measure workbook tool. So we walked you through the components of that. And you also had the opportunity to fill out that measure workbook tool and send it in to us for feedback. So thank you for those of you who did that. And hopefully that feedback was really helpful in just taking the measure really to refining it. There were a lot of great measure workbooks that were submitted, a lot of access and engagement, but some other measures too. And I also wanted to bring in some of the discussion that I think probably occurred mostly at the office hours, but I think it's really important to share And there's a lot of complexity and a lot of things to consider in developing your measures. And quite frankly, it's not always easy. So there's a lot of different ways to look at our metrics. And, if I think about the access and engagement, there's different ways that you can measure those things. And it all comes down to what's important for your organization, what's important for you to know. So bringing in some examples, there's a lot of discussion about with engagement. Do you include and measure individuals that are maybe leaving against medical advice, or who proactively choose not to participate in your program? Do you remove those from the denominator, or do you keep them in and track it as a separate component? So you have to think about what's going to be useful for you to know about that measure. And that actually leads into some thinking that we'll walk you through that relates to preparing for your data visualization, kind of understanding what is it that you need to know, and do you have the data to tell you that? We talked about the details are important, the specifics are really critical. And we also talked a little bit in the office hours about the challenges in measurement. So sometimes you might know that there's some piece of information, some data that you would really like to have in order to enhance your measure, but maybe it's not easily accessible. Some of those challenges can be from, well, this is something that's put in the notes field in our system, or it's just not something that's in our system in a way that we can pull out and access the data. Or it could be that you've got some information in one place and information in another place. So it's critical to really assess the complexity and the resources needed to get to the data that's important for your organization, and balance the benefit of that measure in cases where you're considering maybe some manual effort to get there. So those are some of our highlights from our last session. Let's talk a little bit more about what we're going to talk about today. So a big focus of our conversation today is data visualization. So taking that data, you've defined your measure, maybe you're already collecting your data. How do you take that information, that raw data, and turn it into business intelligence, turn it into information that you can use and that others in your organization can use? And so we'll talk a little bit about what's the thinking that you need to do before you get to visualizing your data to make sure that you have really effective data visualizations. And we'll talk about the tools that you probably have at your fingertips that can help you transform that data into really useful information. Many times the reason you're visualizing that data is that you're going to be sharing it, you're going to be communicating results, you're going to be communicating information that needs to have decisions made on it. So we also want to touch on communication. How do you build an effective communication strategy? And we've got a little tool that can also be useful for you to build out your communication plan. So that's our focus for today's session. And let's move into it. All right, so we're going to start with our data visualization, which is really about transforming that data into business intelligence. So we're going to start with a poll question. We'd love to hear from you about, does your organization provide data in a visualized format that's easy to understand? So go ahead and start putting your information into the poll. We'll just give it a moment to kind of settle in. Okay. All right. So we've definitely got a mix. We've got some individuals that are feeling really good about the data. It's visualized and it's easy to understand. We've got some people that have not yet visualized their data. So I think today we'll give you some really good information to think about before you head into that. And then we have some that are visualizing the data, but think that maybe it could be improved in terms of how to help that data be more understandable and easy to use for your organization. So this is great. Thanks for sharing that. I think that helps kind of give us a good foundation for the information that we want to, oh, I'm just going to say, I don't know if I shared the results, so I'm hitting share results. So hopefully you can see that. Just to repeat, we've got about 21% that say they visualize their data, and 35% do not yet visualize it, and about 44% saying that they do visualize it, but it could be improved.
Yeah, and then we can see the results, just to let you know.
You could?
Yes.
Okay, thank you. I wasn't quite sure if I was sharing that or not, so I appreciate that confirmation. Okay, so let's talk a little bit about the data requirements in our pretty much constantly changing environment, right? We know that we're living in a time of change, but it's always been a very dynamic and changeable environment that we're functioning in anyway. So we understand that there's really a need for timely and accurate information, and we need that information to inform our decision making, and probably we need it pretty quickly. So that's the reality that we're living in. We understand that data-informed decisions are really the key to success, especially in a value-based environment. You need to have access to information. You need to know results. You need to understand your environment and be able to speak about it from a data perspective. I think a lot of times people have a gut feel of how things are, or they might feel, oh, there might be something going on here. And data takes that gut feel and it turns it into, yeah, this is what's happening. And then you can start to think about, what do you do with it? The reality is that our data is very likely created in different applications, and it might be stored in different locations and maybe in different formats. So one of the things that's critical in terms of getting to the data that you need to really be able to make those decisions and inform about what's happening in your organization, it means you're going to have to bring that data in from various places and put it together in one place to give yourself a complete picture of your environment. And ultimately, once you do that, it's got to be able to be accessed by the people who need to get to it in a way that's easy to use and easy to understand. And that's really where data visualization comes into play. So this is a really, really simple illustration of the benefit of visualizing your data. So if you look at the Excel spreadsheet screenshot at the top of this slide, there's a lot of information there. By the way, none of this is real information. If you can read the names, you'll know that pretty quickly. Pull out some commonalities about these different individuals that we've got in this data. So by simply taking the data and putting it into a visualized format, a chart format, a pie chart, a bar chart, you can start to much more easily see what's happening. What is this data telling you? And these are really straightforward, simple visualizations, right? So this is just a chart of the diagnoses. You can easily see there's one diagnosis that's really the most common. You can see when you have more of one thing versus another. So just a really simple illustration of how visualizing your data can be so meaningful. So why do we want to visualize our data? At the end of the day, delivering data to our end users in a dynamic, visual, and easy to understand format really has the potential to improve the effectiveness and efficacy of our organization. And some of the different aspects, the different components where data visualization can really come into play are communication. It can help with decision making. We know that that's important. Having access to the data can help you solve problems. It's a great tool for knowledge sharing throughout your organization. Having the data can contribute to building good consensus. And when we started this this learning collaborative, we talked a lot about the culture of change, and data is a really good component to help you drive change in your organization, because you now sort of have the basis to get people behind what's happening, help them understand what's going on in the organization, what might need to change, what decisions need to be made. And so that can facilitate buy-in. So there's a lot of different components about why data visualization is really a critical element for your organization. So when you want to start thinking about building effective data visualizations, like, where do you start? So maybe you've got some information, maybe you've got some of those Excel spreadsheets, maybe you're starting to get an idea of the different data sources in your organization. So where do you start with what do you want to visualize? Start with what's important to your organization. So we talked about key performance indicators. Those are your critical few measures that are going to help you evaluate the success of your organization. Those are things you're going to want to visualize. We've already mentioned, if you don't know where to start, think about access and engagement. But we also acknowledge that there's other data components that are going to be important for your organization. Again, you want to think about those key performance indicators. And really, just as a reminder, this is where those definitions of your measures and your metrics come into play. What does access and engagement mean for your organization? I can tell you by looking, even from the discussion that we had in our last session, and by looking at those measure workbooks, it's not the exact same thing for every organization. It's very similar, but there might be some really different nuances. So before you visualize your data, what does that data really mean? So you got to kind of go back to that measure workbook that you filled out. And after today's session, you might want to go back to the workbook that you created and do a little bit more refining, so that you know that that's going to create measures that you can then visualize in a way that's really meaningful for your organization. So a few things, thought starters to get you to think about your data visualization. And really, you need to think about these things when you're in that phase of defining your data and gathering your data. And it's all about understanding that you have what you need to visualize the data in a way that's meaningful. So what do you need to know? Do you need to know how many of something, how often something happens? Do you need to know who? So demographics is a component that we very frequently, well, actually always recommend that you have within your data, so that you can start to segment your data. Maybe it's by looking at data from a gender perspective. Maybe it's by looking at your data from a race perspective. Being able to take those measures and break them down into different components is going to really help you dig deeper into the data and better analyze it, especially when you're looking at where are there opportunities for improvement, where are we doing better than another place. So think about also, what decisions is that data driving? What is it that you are going to need to, what action are you going to need to take off of this data? And does the data give you everything that you need to know to make those decisions? Some ways to look at it is, do you need to know if program A or location A is performing than program or location B? Are you measuring results versus what your expectations were? So those are a few things that you might want to think about. At the end of the day, what you're doing with this thought process is building the construct of what you need to evaluate with your data. What do you need to know to dig deeper into your data? And that is going to inform how you build your visualizations. So some thinking ahead of time is going to make sure that you've got what you need to build some really strong data visualizations. So I'm going to turn it over to David for a bit here. So David, I'll let you kind of take it from here on our data visualization segment.
Thank you, Lynette. Well, as Lynette was talking about, we're really thinking about how we visualize our data and how I describe it, how we deploy our data across our organization. One of the concepts that I like to talk about is self-service analytics, and it's pretty much self-explanatory. You need an approach to your data delivery and analytics that really allows your end users with little or no background in data analytics analysis to access and use data for decision making and to gain insights. One of the things that we talk about when we talk about business intelligence is not only doing data analysis, but also use your data to gain insights, to take a look at the way data is related to each other. I do a lot of times just take an initial data feed and use some of the Excel tools to begin taking a look. What does it mean? What does it tell us? What are the relationships here? But when you create your data visualization, you're creating it for a specific reason, for a specific level within your organization. So not only do we need to present data in an easy to understand format, but we also need to present data in an easy to manipulate format, and in a format that really meets the needs of different levels within your organization. So you may have a metric related to a program. So say let's take an example, staff productivity in a clinic. And maybe your executive leadership needs to understand productivity within the organization, within all of the programs. And then your program manager may want to look at productivity differentiated by clinic or by location. And then your clinical supervisors are going to want to know productivity based upon at the staff level, and then your individual staff wants to know what their productivity is. So as we think about visualizing data, it's not only taking data and put it into an easy to understand and easy to read format, it's building these kind of layers within your data so you can use a single data set to meet the needs of different levels of your organization. And the last thing in self-service is common language. For those of you who have worked in data sets, many times the data, it has codes. As an example, you may have a staff ID in your billing data as opposed to a staff name. Or if you're, again, working with billing data, you may not have a description of a service. You may have a procedure code. Well, in self-service analytics, you have to provide the data using common language. You can't expect everybody to memorize everybody's staff ID or to know the codes, your internal codes for different programs, or to understand what actual service type a procedure code is. So what we need to do is really think about assuring that we use the common language that your staff are used to talking about and using when they reference programs, services. So if we want to review what self-service analytics needs to be displayed in easy to understand format, graphs, charts, easy, simple pivot tables. You need to filter and build filter environments so you can really drill down to the greatest level of detail or drill up into a more global kind of analytics. And finally, you need to use the language that your staff are used to using in understanding the different components of your analytics. Next slide, Lynette. So here's an example. We have data visualization example, and you have diagnosis and presenting concerns. And so we have a little pivot table. I just want to say that all the visualizations that we're using today are built with Excel. I'll be talking much more about that when we do a little bit later in my presentation. So let me just pause and talk about tools for a second. I know we'll talk about them more a little bit later, but there are many different data analysis and data visualization tools. My recommendation to folks is you start with the tool that you have on your desktop. And I would venture to guess mostly everybody, if not everybody, who's listening to me right now has Excel on their desktop. And will have all different levels of ability to use these kind of tools, but they are tools that you already license, and they're tools that you have expertise in at some level in your organization. It may be in finance, it may be a quality assurance, it may be in your IT sector, but you have the tools, you have the knowledge, and these are the tools that I always recommend that we start with. So in this case, a question came in on the chat. It asked what a pivot table is, and I'll talk about pivot tables when we get to the example that I'm going to show. So you'll see across the top, these are our filters. They're called slicers. And so basically what we can do is we can take our data, and now we can slice it. And we can say, okay, what does our data look like based upon gender? Or what does our data look like based upon ethnicity or race or age grouping? And we may have different needs for that kind of information. We may, being taking a look at, are there gender differences? Are we sensitive to gender differences in some of the program work that we're doing? Are we sensitive to diversity and ethnicity when we take a look at our performance across some of our analytic measures? Age certainly is a difference sometimes. So as you see is that what we have here is an example of taking data, put it in a visual environment, adding those kind of filtering mechanisms to it that allow you to take a look at your data under sort of different circumstances, answer different types of questions, understand your performance in areas where you can really look and ask yourself, all right, are we meeting the needs of the individuals we serve across the differences that they present to us? Next slide, Lynette. So here's another data visualization example. So this is an outcome metric. So what do we have? We have outcome metric 1, initial evaluation performed within 10 days of initial contact. And our agency goal is 100%. Now that sounds like a common kind of goal that some of you may be working on. So what did we do here? So we took some of our data, and the basic data that we took is we made changes to our EHR, and we added a field that we recorded the date of initial contact. So we had that data built in, and it was a new data element. We had not been collecting that before, so we found a way and a place to start collecting that data. We built workflows around that data element. We did training. We monitored initially to assure that that data was going in. It was going in all the time. It was going in correctly. So we had to make some structural changes to the organization, to our data recording environment, to create a data element that we didn't have before. Then initial evaluation. Well, we could pull that data right from our billing data, because certainly every initial evaluation is recorded as initial evaluation. There's differential rates related to that. There's differential codes related to that. So now I can bring in data that relates to when was the initial contact, when was the initial assessment. And so what we did is the first thing on the upper left-hand corner is what we call pivot table. It took a large amount of data. You'll see I had data from June, July, August, September. I had data from 5 different programs. I had data from 15 different payers. And so a pivot table allows you to take a large amount of data and aggregate it or sum it or average it or bring it down into a more usable context. And so what we took all this data and we said, okay, I'm going to create a table, and in that table I want a row to have a month, the number of intakes, the number that were less than 10 days, and the percentage. And so we built this little pivot table and put that in there. My slicers or my filters allow me to take a look at how we're doing across my different clinics. And I can also see how we're doing across our different payers. On the lower right-hand corner, I have the average number of days, and then I have a longitudinal chart. One of the things that I look at all the time is creating longitudinal charts so you understand trends. Understanding trends for data visualizations, depending on the data type, but in many cases, understanding your trends are a critical component of data analysis. So how did this work in real terms? Okay, so we started collecting these data. We put it in. Everybody was on board. You'll see in June and July and August, we were hitting our goal 100%, really great. September, things started slipping a little bit, but we said, all right, 92%, that's fine. And suddenly in October, we're down to 65%. We said, okay, now we need to start looking at this. So we went in, what's happening? We didn't start that conversation till the end of October. By November, we had fallen totally off of our goal at 47%. We did a root cause analysis. What we found was that there was a critical staff who left the organization. We hired somebody. There was a training period. The training didn't go as well. We weren't doing the kind of follow-up that we were expecting that we were going to do from initial to make sure that people got in within those 10 days. And so we made the changes in late November. December we started picking up, and then January we were back where we wanted to. So just as this example, sometimes you have to go in and you have to create a new data element. Where are you going to put it? How are you going to collect it? How are you going to ensure that you train people properly on using it? And how are you going to monitor to make sure that the workflow changes that you put in place to collect new data is actually working? The second piece is that, okay, what are the different elements? What are the different slices of data do we need to take a look at? We need it by program. We need it by payer. These are key performance. One of our payers actually pays us a small stipend or a small bonus for 100% performance. So we certainly want to know how well we're doing on that payer. Then we create a visualization. We create a longitudinal visualization, and we build a quality improvement kind of process within it. So we're able to watch what's happening. We're easily able to see in the pivot table that I've got a green check mark. I know I'm doing great. I've got a yellow circle. I know I'm falling down. Time to start thinking about this. I know that red, we're missing our mark. We need to pay attention. We need to do something differently. So this is an example of a data kind of visualization example. What you need to do, how you may want to shape your data, how you may want to shape your slicers, the kind of information you bring forward, and make a longitudinal example. Somebody said, how do you get those checks in your that's part of two things. You can do it two different ways. One is conditional formatting, and the other is through KPIs. I'll show you the KPI piece. I'll show you a little bit of conditional formatting. I do want to say that this presentation is in no way, shape, or form a tutorial on how to use the data analytic tools within Excel. I do that training. That training normally goes over 4 sessions. And so it would be extremely difficult. I'm happy to answer questions, point you to the different kind of functionality. I'm going to actually demonstrate or show you, point to where the functionality is. I think that these tools are absolutely critical tools for you to be able to understand, to be able to employ in your organization. So we'll spend some time, but you're not going to walk away understanding how to do this stuff. So next slide, Lynette, please. So data visualization, I talked a little bit, there's a lot of tools out there. You hear, we throw around the concept of business intelligence all the time. Business intelligence it's a bit more than data analytics. When I think about business intelligence, I think about where is my data? How do I access my data? Where do I store my data? How do I bring data from different data sources together? How do I create a model? Our world is not single-dimensional or in a single dimension. And so our data models sometimes really need to be informed by data that lives in different places. An example off the top of my head, some folks use a billable to paid hours metric as a standard for productivity. Well, the paid hours is in your payroll system. The billable hours are in your billing system. And you have to bring those two things together. So there are tools then for accessing and joining data from different data sources. Then there's really complex visualization tools. And I think the two that really we probably talk the most about at the higher level tools are the Tableau, which is a sophisticated and really actually a very excellent data visualization tool. The other tool is Microsoft BI, Microsoft Business Intelligence. Both these tools have a server environment. They have very robust development environments. There are licensing fees. There's certainly training. I find that those are normally used by larger organizations who have more resources available. But what I like about Microsoft is basically they took their high-end data analytic and visualization tools that they have in their Power BI, and they've brought them down to Excel. And I'll show you some examples of that. So, I'm not here to sell you necessarily on Microsoft, but I do want to point to the fact that there are extremely robust really enterprise-level analysis and visualization tools living on your desktop right now. Next slide. So, what are the business intelligence tools? When we were first beginning to talk about content for this series, one of the things that I had really talked with Lynette about is that as we talk about data visualization, and the components of that, and the importance of that, it's also important to give you some ideas about some of the tools that are available to you. And so I'm going to focus on the business intelligence tools inside of Excel. And somebody asked, what is a pivot table? I'll show folks a little bit, but it's really, pivot tables are really essential functionality. It allows you to summarize and filter large amounts of data in an easy to use and easy to understand format. So inside of Excel now, with your business intelligence tools, you can bring in more than 1 million rows of data. So if you brought in 1 million rows of data, let's even make that, say 10,000 rows of data. Say you had 10,000 records, billing records. Well, how do you make sense of that? Where a pivot table would allow you to do something very simple. It's, as an example, you could take all your billing data and you could say, okay, build a table for me. And a table is just a row and columns. And in the rows, bring a description of the services that we provide. So if you provided 10 services, you'd have, each of your row would have one of your services. Then you could say, count the number of services that we provide for each of these services. And suddenly you could go from 20, 30, 50, a million rows of data and simplify that to 10 services and a count of how many of those you provided. You could then take that further and you could say, okay, let's put into my pivot table the month that we provided it. And now suddenly you have a pivot table that gives you the count of service by month. The next component would be a pivot chart. And that's functionality that allows you to take your information in a pivot table and create charts and graphs, a visual representation of your data. So let's take the example that we have on each of our rows a month and a description of services. We could, by a press of a button, create a chart that shows us the number of services by type by month, with a line graph showing us and a trend analysis showing us what our trend is going forward. So a pivot table allows us to take large amounts of data and create simple aggregations. The pivot charts, with basically a click of the button, allows us to take those tables and create a chart. Now, those are functionality that's lived in Excel for a long time. They've gotten better over time, the number of charts that are available. They'll suggest charts for you based upon your data constructs. And so they've really tried to do self-service analytic development for you. Where you could go in is create a pivot table. Excel will even suggest pivot tables for you. It'll suggest pivot charts for you. So it really doesn't it makes it easier to interact with your data on a self-service basis. So then you have Get and Transform. So these are the Excel features that provide fast and easy data gathering and shaping capabilities. I'll show you that one. And Power Pivot, that's an add-on in Excel that enables you to import large amounts of data into Excel and create relationships, calculated fields, measures, KPIs. It's really the backbone of your analytic environment. So let's move on. And what I think we're at a point where I'm going to ask Lynette to stop sharing her screen. And I'm going to share mine. We're going to take a look at a actual example of a data visualization using Excel. All right, so let me get to a screen share right here. Share that. Let me bring this in. All right. I'm assuming that everybody can see an engagement analysis, third visit within 30 days spreadsheet.
Looks good.
Okay, thank you. Let's get this out of the way. Let's collapse the rhythm. Okay. So what did we do here? So this is an example of saying, all right, we have a new metric, and what we want to do is we want to analyze our engagement. And what did we do? How did we define engagement? In this case, we said, all right, if we have an initial evaluation and a third intervention occurs within 30 days, the individual is engaged. Right? That definition is an arbitrary definition. This is arbitrary data. But certainly you decide what your metric, what your numerator is going to be, what your denominator is going to be. And so what we did in Excel is we created a data input tab. So in this input tab, we have a couple of different things. We have a client ID if we wanted to do analysis by client. We have the staff ID, who did the basically responsible for the client. We have an intake date. We have a description of the service that's provided. And we thought that, well, engagement is important, but we also want to understand engagement by the session type. And we defined our session types as in-person, telephonic, and telephonic with video. We understand that some kind of telephonic with video for our services will become a standard feature of some of the ways that our platforms are providing services. We want to understand engagement by session type. And so we have our assessments, we have our session type, we have a second assessment date, we have a second assessment visit type, we have a third assessment date, we have a third visit type, we have a telephonic, we have a session type, and then we create a formula here at the end of our table that basically says, you know, if our initial assessment is less than 30 days from our third visit, then put a yes, and if not, put a no. So if the client is engaged, we have yes. The other thing that we built is we use the functionality within data tables to do drop-downs. So I go down to the end of here, and I put a new record in. You'll see that we have drop-downs here, so I can select my staff. I might be able to select my visit type, and we build those drop-downs here. So we do have an opportunity within Excel to create drop-downs. One of the things we think about all the time with data is we need data to be clean. We need it structured, and we need it to be consistent, and we need it to be validated. So there are functionalities within Excel to allow data input by drop-downs and data validity to assure that the data that's in your chart is valid and complete in your table. So I'm not going to spend a lot of time around drop-downs. But what we did here is we created all of our drop-downs so we could input data using our drop-downs. There's two other things that we need to set for this analysis, because we're not only taking a look at engagement, we're taking a look at engagement by service type, but we're also want to take a look at revenue. So what's the revenue difference for those individuals that we engage versus those that we don't engage? And so what do we need to understand that? Well, we're going to use our ambulatory patient grouping weights, which is the way that Medicaid bills or pays you. So we're going to set a base rate here for our calculations, and then we're going to set our engagement target. We'll set it at 50% right now, and I'll show you how that changes. So how do we do this, and then how do we create these visualizations? Well, I talked about two tools. One is Get and Transform. Get and Transform lives in data, and you have functionality over here in the left-hand corner that allows you to get your data. But what it does is it creates what are called queries. And you'll see over on the right-hand side, basically what you do is you point to your data, then you're allowed to transform it. And you may transform it by, you may have a large data set with more columns than you need. Get and Transform allows you to eliminate columns. You may have rows at the top that you can't utilize. It'll allow you to delete those rows. You may be connecting to CSV, which is text data. And so your data for date comes in as a text field. You need it to be a date field. You can change it to date. It allows you to transform your data. So what we did here is we connected to each of the different tables that we have, and we transformed that data, getting rid of columns we didn't, making sure we had proper data formats for the different data elements we need. And then what we did is that we loaded it into Power Pivot. Power Pivot, folks talk about warehouses, data warehouses. Power Pivot allows you to build what we call data marts. It allows you to take information and create a model of that you can use for analysis. So let me show you a little example of that. So let's go over to Power Pivot. And
So David,
sure.
Just wanted to jump in because there's a little bit of discussion in the chat that I thought I'd let you know about as you're going through the demo. Some questions about how that data gets entered into this into the input sheet. Is that getting entered by hand or people exporting it? And there's some discussion about how some people are expressing that, you know, their ability to get their information from their system is labor intensive or challenging.
Right.
So I don't know if you want to maybe touch on that at some point.
Sure, absolutely. I think that there's, you know, what we see normally and what we try to do all the time in terms of access to data is to access data from existing applications. And that could be from billing systems, it could be electronic health record systems, it could be from payroll systems, from accounting systems. What we always try to do is to bring data down directly, because the Get and Transform tools really allows you to take the input that you've already done when you've created records in your application. When you create a billing record to go out to billing, you create all the data that you need. You've created the date and the type of service and the procedure code and who provided it and where it was provided and who the payer was. So what we try to do is import that data into these models. Now, I understand, and we work with a lot of organizations that find that difficult. And they find that difficult because they don't have the expertise, or the systems were not initially configured in the way that they need to. But what I do find is that most good billing systems, electronic health record systems, payroll systems, general ledger systems has an export function. And sometimes they allow you to export pre-existing reports, but they'll allow you to export into, say, an Excel format, or to a CSV or text format. And so you can export. Many of these systems also have what are called query languages that allow you to go in, select which fields you want, and then create the download of the data. You could filter at that level, so you can take your large data set and make it smaller. If, in fact, you can't do that, if you don't have the skills, or it wasn't configured correctly, then the other piece is that, particularly for a small project, you could create a sort of off-system input table. And this is the example here of an off-system input table where you'd have workflows that assured that for every initial assessment that we inputted data about the next 2 visits and the type of service that was provided. That's the reason we build these with drop-downs, is so your data will be consistent. People don't have to make things up. Again, we always really try to get folks to be thinking about building skill sets in their organization to be able to bring data directly down from the systems that you interact with and build, and then have created the data. You know, duplication of input is something we try to avoid whenever we possibly can. Hope that answered a little bit the conversation that's going on. So let's go back and show a couple more pieces on this. So I showed the get and transform. Again, this is not a tutorial. It's just pointing you to some of the features that are available to you. So we started talking about Power Pivot, and this is your tabular data model. This is where you build your data model. And what you can do in Power Pivot is you can create measures. So as an example, I created a calculation, which basically a calculation of percentage engaged. And that calculation was I took everybody who had an engaged yes and divided it by the total number of intakes. And so what's nice about a measure is that you'll see I use percentage of measure in my engagement percentage by staff. I can also use percentage engaged in my pivot table around engagement level by initial contact types. So when you create a measure, you can use it across different analysis. It's the same computation. It's the percentage, but in this case, I can say, okay, what is my engagement percentage by staff versus what is my engagement percentage by contact type? So you can create measures that you can use for different types of analyses. The other thing that you can do inside of Power Pivot is you can create KPIs. Simple KPIs that allows you to set standards. So basically, I'm going to set a KPI status. I'm going to set an absolute value that we're going to monitor against. I tell it where I want my ranges to be, and then I tell it what my icon style is. And if I wanted to add that to my analysis, I could go in here, and I could go to my design, and let's take my pivot list, go down to, let's see, where is it going to be? It's going to be here, and you'll see it's sitting right here. I can bring status in here. And as we saw before, suddenly I've created a simple KPI. I'm able to bring it into my analysis, and now I have a visual representation of how well each of those individuals are doing. So what we've done here is I've created a pivot table. So what is important for me to understand? It's important for me to understand the total number of intakes. I want to know how many of them were engaged. I want to know what the percentage was, and then I want to know, be able to visualize, all right, this is good because my standard is 50%. You'll see that that's right here. 48 is yellow. It's not bad. It's not red. We're not going to bang people over the head. Another 48, we're doing pretty good. 70 is obviously great. The second thing here is I'm going to create a chart that helps me see by staff the percentage of engaged against their actual target. So I can quickly see who's below, I can quickly see who's above, and I can quickly see how much above somebody is in comparison to somebody else. So I look at staff 1. Now, this is a misnomer. I have to go back here. They only had one intake, and so they're at 100%. So that's an outlier, but I can tell that that's an outlier by looking over to the pivot table. So these two work in combination with each other. The other piece is that I wanted a revenue evaluation as part of this. So basically what I did is I had APG weights. You saw that in the drop-down. So for each of the service we provide, I know what the APG weight. I can build a measure that basically takes the APG weight for the service, multiplies it by the base rate that we set, and creates a dollar value. And then I can build a pivot table that says, okay, how much revenue did we generate for those individuals who were not engaged, and it was 12,000. And what was the revenue that we generated for those who were engaged? And it was 17,000. Simple calculation, 44% difference. Conditional formatting turns that green. And then the final piece we build in here is engagement percentage by initial contact type. Another pivot table that we then create a pivot chart and a slicer that allows me to then select this by staff. And you'll see, watch over here, you'll see the pivot table changes as I select a different staff, and your graph changes. So I think that really what I wanted to try to do here, and you know, for you geeks among us, you know, you're going to be looking at this and hopefully rushing right out to begin your training on the BI tools, living in Excel. But for others who I think that what I really wanted to do is talk a little bit about what's available to you today. What are the simple tools that you can use and how you can build a robust analytic environment out of a relatively small data set. How you can create your data in a visualized format that's appealing, that's easy to understand, and that allows you to gain insight and drive decision making and determine where you need to best spend your efforts. So with that, Lynette, I'm going to stop sharing my screen and hand this back to you.
Okay, great. And I am going to get back to the slides. And there were a couple additional questions in there. But why don't we kind of get through the communication piece, and then we'll go back and talk to those. So, and also a really great suggestion to use Teams to start a thread about a particular topic. So I think that that is a great idea. So let me get back to getting my slides in presentation mode. All right, so can everyone see my slides again?
Yep, looks good.
Yep.
Thank you very much. And thank you, David, for going through that. There is, I think as David said, today's session was not intended to try to teach you all of the particulars of how to use that, but to make sure that you really have a sense of the possibilities and what powerful tools you probably have at your fingertips. So, so don't walk away, especially if you haven't used those kind of things, thinking, whoa, I didn't get all that. There's really more for you to learn, but we wanted to make sure you kind of had a sense of what was out there. And so let's talk a little bit about communication. So this is really a logical topic to follow on with data visualization. So you visualized your data, you've taken that complicated spreadsheet and you've turned it into some visuals that are easy to understand. Perhaps you've been able to get those visualizations in a self-serve format, as we mentioned, is so important. But you've got to also do some communication. So let's talk a little bit about building an effective communication strategy. And we've also got a tool that can maybe help you develop a communication plan if you would like to have a little format to do that. So building your communication strategy. So there's a couple of key components. So think about your audience. And the reality is you probably have more than one audience. So it's really important to identify who do you need to communicate to, and realize that you're going to have some different parties involved in that. Another critical component is thinking about what is the purpose of your communication, really. What is your key message? One of the things that I think is really important to think about is that the consistency of your message is critical. So really, if you've got a lot of this data, you've visualized it, there's now something that you need to communicate about it, being really consistent in what that core message is crucial. Now, how you deliver it, the level of detail that you have behind it, those kinds of nuances might vary based on your audience, but the general message should stay the same. And I think it's important, especially for those of us that get really excited about data and we love to look at the data, we like to dig into it. I think it's important to kind of step back a minute and realize that we're delivering a message, we're not delivering numbers. The numbers, the data, that supports the message. So make sure you frame it in a way that really is about the message and not about the numbers. And another key component, so what's the call to action? What is it that we're asking for out of this communication? So that might be thinking about what decisions the data is driving. What is it that you need the individuals that you're communicating to do with that information? And if the answer is nothing, like think about what's the point of the communication. And there are times when there's informing about results and things like that, but generally there's a purpose. And I think especially in today's world that we all exist in, we've got an overabundance of communication. So it's critical to think about, like, do I need to communicate this right now? So think about the purpose, and that's going to help you drive what it is that you need to communicate and what's really critical to communicate. And just the basics of keep it simple, keep it direct, keep it relevant. Again, I think that talks to the fact that we are probably over communicated to, and understanding that we're going to be getting effective communication from somebody, and relevant communication is going to help that communication be paid attention to. So we don't want to be over communicating in a way that is like, oh, I don't need to look at that. That's just another noise in my inbox. So some critical things to think about when building your communication strategy. And there's also some pitfalls to avoid. And we probably touched on some of those in building the strategy, but it's really important to understand the purpose of your communication. It's important, for those variety of audiences that you might be talking to make sure that you are creating the context for the information and clearly communicating what the objectives are. It's very important. Another pitfall is really failing to recognize the communication requirements of your audience. So you're going to have different audiences. Maybe you're doing communication to staff. Maybe it's communication to your board. Different audiences are going to have different needs. So how often do they need to be communicated to, and what exactly do they need to know? And another consideration is your communication method getting through. There's not one right answer for these questions, but think about your audience and really what's going to be the most effective way to communicate. Another challenge and potential pitfall is kind of diving too deep. So not everyone needs all of the gory detail. Some people might. So, and again, it can dilute your message. If you lose people in so much detail that they lose the message, that's something to be careful about. The number 4 is lack of flexibility. And that's really just speaking to, if you're communicating in a way that maybe isn't working and you're doing it because that it's always been done this way, you might be heading into the pitfall of lack of flexibility. So take a step back, evaluate the communication that you're doing, see if it's working, and if it's not, make a change. And then the last one is to make sure that you don't assume that what works for you works for everyone else. We talked about, you have different audiences, you have different people with different levels of knowledge about data, sitting in different parts of the organization. So again, you probably know the most information, remember that you might have to kind of create that context and make the objective of your communication clear. Okay, so a communication plan. This is pretty straightforward and pretty simple, but it's also really important to do. And you might have a communication plans for different things. So you might have a work group that's trying to that's undertaking a quality improvement initiative. You would create a communication plan for that work group. Who do we need to communicate to? How often? You might have a different communication plan for a different level of data information. So maybe you have a communication plan for your key performance indicators. So you might have more than one communication plan, but the components of a communication plan are basically the same. You're going to define who you're talking to, your target audience. You're going to define what you're talking about. So what's your communication content? You're going to define why. That goes back to that objective. And if there's not a why in there, you might not need to communicate to that particular audience. The how is thinking about the format. So is it best delivered through email? Is it best delivered through a live communication or a Zoom meeting? Is the information does it need to really be pushed out? Or we talked a little bit about self-service dashboards. If people are able to go and access the information themselves, again, you can, that becomes how they get the results communicated. And when, so the frequency, is this a monthly communication? Is this a quarterly communication? Really basic questions, but outlining those components can be really, really useful to make sure that you've covered all your communication needs. So if you've spent time defining your measures, understanding what you're measuring, you've spent time visualizing those measures so they're easy to understand for people, build a communication plan so that everybody who needs to know about them does know about them. We have developed a communication plan tool. It's those components that I just talked about, really straightforward format, but useful to fill out. So if you would like to use this, you can certainly develop your own, but I would encourage you to maybe take a moment and think about the work that you're doing around your measures and your metrics, and developing a communication plan to make sure that that work is not happening in a vacuum, that it is out there, and that the individuals that need to know about it do get that information. So we are kind of coming to our close. We have a little bit of time for some questions or discussion. And I know we had a few extra questions from the previous session. So let me just talk really quick about what's coming up next, and then we'll open it up for questions. So in terms of what we would like you to think about doing from today's session is take a minute and go back to some of those initial slides that create the groundwork for before you dive into data visualization. So think a little bit about, what do you really need to know? What does that data visualization need to inform? And maybe go back to that measure workbook that you've done and make sure you're gonna have all the data components that you need in order to build visualizations that are meaningful and useful. You might need to, you've had a lot of information about the powerful tools that you have access to within Excel. So you might need to do a little bit of investigation about what are your options for actually visualizing that data. Maybe there's a little bit of additional learning that needs to happen before you can dive into some of those new tools that you might have heard about today. So think about where you're at, where you want to be, and what you need to do to get there. And then I'd also encourage you to use the communication plan tool and start to think about, as you're working in your work groups or on initiatives or on your key performance indicators, what's your communication plan for those things? The 27th is going to be our office hours. We will send out a registration link, and I've got one in the presentation here. And our part 4 of measures and methods is on November 10th. So you will have your registration link to your office hours. Of course, bring your questions to office hours and send any questions ahead of time to us in the team site. We encourage that. And let's take a moment to open it up for some questions and discussion. And I think it might, I'm going to just kind of revisit the chat because I think we already had some there that were not already addressed. So we'll start there and then you can either speak up or type in if there are some additional things. So David, I think we've got a couple for you. There was one that was specifically about the get and transform and inquiring if that's a fast way to repeat the same formatting changes every time. So the example that they gave us, they have a long data string that they have to convert into month, day, year. And every time they pull down the data from SQL, it's time consuming in the aggregate to do that every time. So can you speak to that?
Sure. I mean, actually, to be perfectly honest with you, that's one of the primary advantages to using get and transform. Because what I didn't show you is that when you create your first data query, you create a set of instructions. And the instruction may be, okay, connect to this table. The next set of instructions says, okay, eliminate these columns. The next set of instruction is take this date and convert it. You know, create, sometimes what you get is you get text dates that actually need to be converted into actual true dates. And sometimes it's as simple as saying, make this field a date field. And you create all of those, and at the end of those set of instructions, you have this transformed data set. Every single, so there's a button on Excel called Refresh All. And when you hit Refresh All under the Data menu, it's going to refresh all your queries. And it's going to go in and it's going to take each of those steps, and they're going to duplicate it. But they're going to duplicate it against a new data set. So as an example, a lot of times what we do is we'll bring down January data, we'll build the query, we'll put the steps in, we'll build our visualization, and then in February, we'll bring down January and February. Well, what we'll do is the data is in the same format. We'll do refresh all. It'll go through each of those steps. It'll transform your data, and you'll have exactly the data set that you need for analysis. So your description of the problem is get and transform is the perfect tool for addressing that.
Great. I'm sure they're happy to hear that, David. It sounds like there's a sigh of relief going on.
And if you're already transforming, I mean, if you've got a SQL data set and you're already transforming, my guess would be that it won't be a huge leap. There won't be a huge learning curve for you. I think the get and transform, particularly for data, for folks who've been manipulating data, knows how to write queries, it's pretty intuitive. I think you'll pick up on that really pretty quickly.
So we have another question about the data related to engagement and access. And then after that, there is a question on the communication plan. So the next question is, in a team environment, how do you assign engagement and access to individual staff? So I think, David, you showed an example where you could break things out by staff. What happens when you've got kind of a team environment?
Well, you can do, so you may need to organize your data around a team. So what you could have done is say you have 5 members in a team. Well, I could basically use these tools to build what's called a crosswalk table. And a crosswalk table would say, when you find staff 1, assign them to team A. And staff 2 may get assigned to team B. And staff 3 maybe get assigned to team C. And so you build this table, you say, identify this staff with this team. And then what you do, instead of doing your analysis at the staff level, you do your analysis at the team level. So you bring your team into the pivot table instead of bringing your staff. Maybe a difficult sort of to visualize, but one of the real advantages of the tools is to do exactly what I'm talking about, is take these groups of staff and say, all right, every time you find staff A, represent them as team A. And every time you find staff 3, represent them as team B. And you build this direct link between this information and what team there are. Another example we use all the time is when we have billing data. So you may have 20 pairs, and you don't necessarily need to know every single pair. You may only want to look at your data Medicaid, Medicare, and commercial. So we build another crosswalk table that says every time you find payer A, B, C, say that they are commercial. And it's going to take all of your payers who are commercial payers, it's going to dump them into a single category. And then when you do your analysis, you don't bring your individual payers in. You bring your payer type of commercial into your analysis. And it's aggregated all of these and collapsed all of these individual payers into a single group. So, yeah, I mean, that's, again, one of the real tools that we use all the time. It's also a tool that we use as it relates to the kind of self-service common language that I talked about. Is you may have codes in your data that you don't want to teach everybody. You build this crosswalk table, and it says every time you find code 123, call it Westside Counseling Center. So these are pretty powerful tools, not only for collapsing as it relates to your examples, but bringing common language into your analysis.
Great, thank you, David. So we have I have a question that came in about the communication plan. So any tips on getting buy-in and consistency with the communication plan? It seems really basic when you talk about it, but it often is overlooked and not even thought of. And I think that those are some really great points. So the first thing I would say is just documenting your communication plan is an important step. And then actually going out to, depending on the groups, going out and kind of getting feedback or approval of your communication plan if it's necessary. So I'll give you an example. If I'm working on a project, a quality improvement project, I'm going to have stakeholders for that project. I know that there's a group of individuals that is going to need to stay informed. And so I will go, as part of my communication plan, the communication to the stakeholders is going to be part of it. I'm going to outline that I'm going to give them updates on a monthly basis, and we're going to do it in a meeting, etc. So actually communicating that this is the plan with them and making sure that they understand and agree with it can be important. Another element that you can actually apply to your communication plan is almost do like a little bit of a risk analysis. So with your individual lines and audiences on your communication plan, sometimes just doing a little bit of thinking ahead of what might be the challenges in communicating with this audience, and just taking the time to outline those and then outline some potential steps to mitigate those challenges can help make sure that your communication plan is more successful. So hopefully that helps with the communication plan. And those are really great thought, because it is kind of a simple looking thing, but it's often those things that look simple are a little more complex under the cover. Okay, so I'll just take a minute. I'm not seeing any additional questions, but maybe we'll just give it a moment to make sure.
So, Lynette, can I make an additional comment to your answer
absolutely.
on communication?
Sure.
So one of the things that I often think about in terms of any kind of plan, and communication plan being really a critical one, is executive sponsorship. So do we have, and consistency over time. People determine what's important to pay attention to. We have to pay attention to so many different things. Sometimes we then learn to figure out what we need to pay attention to based upon who's sponsoring it, which dictates the importance of it and how consistent we are in following it. If we have a communication plan that does not have executive sponsorship, it sort of comes down a little bit in terms of how people visual or think about that. And if we're not consistent, if we don't apply the plan consistently over time, I'm going to then start understanding that it's not that important. And so there's going to be less buy-in and there's going to be less attention to it. So I think that Lynette's points were absolutely right on. I would just add executive sponsorship and consistently following the plan. And I think that you'll find if you do all the things that we suggest, you may not have as good a buy-in, but you'll certainly get people to pay attention, which is ultimately what you need them to do.
Yeah. Good addition there, David. I appreciate that. Okay, so I don't see any additional questions coming in, and we just have 2 minutes left, so we're pretty much right on time today. There were some thoughts about using the team site to create some discussion forums for some of the different systems and being able to get data out of those systems, which is a really great idea. So you can post in the team site and kind of start a discussion thread. So please definitely use that. So I wanted to make sure we didn't lose that. And I think that closes us out for today. Thank you everyone for your participation, your questions, your thoughts. We appreciate it and have a great rest of your day.